and Lux forceps. Dennis Brown tonsil holding forceps is used for picking the tonsil during tonsillectomy, by grasping the tonsil during tonsillectomy. Lux forceps is used during Caldwell procedure, during polypectomies, or during biopsies. It has got a sharp grasp as compared to the Dennis Brown. The differentiating point between the Dennis Brown and the Lux is this angle present in between the Lux forceps. While there is no angle, it's straight in the Dennis Brown. Second differentiating point is the upper regions. As you can see, it's a diamond shape and it's round surface on the Dennis Brown. The diamond shaped surface is in the Lux forceps. Endotracheal tube is used during anesthesia or if the patient is put on ventilator. Endotracheal tube has different parts. This is the connector, this is the cuff. When the cuff is filled, the balloon is inflated. This is the balloon and this is the Murphy's eye. The purpose of the Murphy's eye is if anything clogs the main way of the ETT, the patient can continue breathing through the Murphy's eye. As usual, there is always a blue line again on this radio opaque line. The blue line is radio opaque line which can be picked in an X-ray which can show whether the tube is in the right place or not. Portex tracheostomy tube is done on those patients who are freshly presented to the ER. The first tube we do is Portex tracheostomy tube. Portex tracheostomy tube has the same cuff and balloon as in the ETT and the same blue line. Portex tracheostomy tube is made up of plastic. Fuller's tracheostomy tube. Fuller's tracheostomy tube. Fuller's tracheostomy tube is done usually when the patient is having a permanent tracheostomy tube or the patient is sent to home on a prolonged tracheostomy tube. Fuller's tracheostomy tube has two parts. One is called as inner cannula, the other is called as outer cannula. The outer cannula always remain inside the patient. The inner cannula can be taken out and it can be cleared and put back. Inner cannula has an opening which can be used for speaking purposes. When the tube is blocked from the outside, the air can go up and it can vibrate the vocal cord if they are functioning. Now the thing inside the Portex tracheostomy tube is stellate. This stellate is only used at the time of insertion of tracheostomy tube. Once the tracheostomy tube is inserted, this stellate is removed and the patient can breathe over here. There is no opening on the tip of the Portex tracheostomy tube, so it's very difficult for the patient to talk. Theodicum, as already explained, one of the most important instrument in ENT. You will always be going to ask to pick the theodicum and use it on the patient. Always remember to pick it up with a non-dominant hand. Always pick it like this. The prongs should be toward the patient and the finger should be towards you. Then take the middle finger and fourth finger and compress it between the middle and the fourth finger and use the thumb for support. This is how you're going to hold a theodicum. Guidals oropharyngeal airway. Guidals oropharyngeal airway is used in those conditions when you pass a tube to a patient and if he is conscious, he bites the tube, ETT tube, so he can compress his airway. Therefore, you pass the Guidals oropharyngeal airway. Or in those patients in which you need to clear out the pharyngeal secretions, or in those patients in which there is a chance of tongue fallback, you usually pass the Guidals oropharyngeal airway. When you pass the Guidals oropharyngeal airway, you get continuous suctioning by the Nelton through this hole. Eve's tonsillar snare is used when the tonsil is being dissected and the lower pedicle is left, and open it like this. When you pull it up, rings come over here. You simply pull the tonsil over here in between this and you simply crush the tonsil. This is called as trocar and this is cannula. Lischwitz trocar and cannula is used for proof puncture, inferior enterostomy. Usually anesthetize the nose and you go beyond the inferior turbinate using the Killian speculum. You put the Killian speculum to expand the nose a little bit. You go beyond the inferior turbinate and you simply push the trocar into the maxillary antrum. You simply take out the trocar out and there is a communication between this cannula is put between the maxillary antrum and the outside. You simply put the normal saline and wash the maxillary sinus and take it back out. This is called as Walsham, this is called as ash. Remember, ash will have equal prongs. Both the prongs are equal. This is called as ash forceps. This is used for the straightening of the septum. This is Walsham forceps. How are you going to differentiate between Ash and Walsham? If you look carefully, it has unequal prongs. This prong is small as compared to the other prong. You always put a plastic cover on one of the prong because you do not want to cause trauma to the external nose while using the Walsham. So the unequal prongs are called as Walsham. The equal prongs which will straighten the septum is called as Ash, and the unequal is used for, which is called as Walsham, is used for manipulation of nasal bone.